Today, we're going to talk about how Arcadia can help you address 3 of the key value drivers across the California market. We'll focus on 3 major areas: social determinants of health, engaging members through text message-based outreach, and relieving provider workloads by surfacing actionable insights at the point of care. For social determinants of health, Arcadia has the dashboard shown on screen pre-built for our customers. This combines not only US Census and ACS federal data sources, but it also brings together clinical assessments, care management assessments, and rich ICD coding and claims coding data to give users a holistic view of the SDoH concerns for their specific populations. You'll see a summary view on this first page, as well as a look at specific utilization and cost comparisons for members with and without SDoH concerns. This helps users drill into what types of care members in this population are using through things like PM-PM comparison and events per 1,000 comparisons. It also gives users actionable numbers that help decision-making around program design and highlight potential ROI. In addition to this summary view, Arcadia also offers a demographic analysis tab. California is a very large and diverse market, so this dashboard will give users a view of the distinct population they serve. This is shown graphically, over here on the left, and also broken out by members who've been flagged for each concern, with information on age, race, ethnicity, and more. Users can look at specific conditions across these populations, breaking them down by SDoH group and control group, as well as viewing specific conditions on the right-hand side. Once you've identified members within this population, use the Cohort Builder tab to help list out the number of patients and continue to refine that pool through criterion like number of specialist visits, ED visits, and total medical costs. In a shift to outreach, Arcadia's Engage module is built to enable text message-based campaigns in a way that makes sense for your members. These are gathered around 3 main focus areas. The public health focus is useful for everything from vaccination campaigns and COVID-19 outreach to annual wellness visits. Gap closure allows users to take the gaps surfaced within the Arcadia platform around both risk and quality and design campaigns to help address closing them. These can all be designed and automated in advance, then run throughout a specified time period for your organization. These text campaigns can also be set up to provide additional resources to members, whether that's recommending telehealth services or additional supports. Here, we look at a sample outreach map with what some of our customers are doing today. This customer has year-round campaigns for things like wellness visits, preventative campaigns that are tied to specific milestones or cancer screening months, back-to-school campaigns for childhood and adolescent immunizations, and then management for chronic conditions. You'll also see time-sensitive tracking for testing like eye exams or breast cancer screenings. To get this information to providers at the point of care, we have Arcadia's desktop application. This is an application installed on the provider's machine, and it surfaces all of the rich insights within the Arcadia data system back to the providers at the point of care. When the provider goes to see the next patient, they'll see this pop up from Arcadia. This is going to tell them all the information about this member, but brought forward to the point of care. The best part is, it's everything that Arcadia knows about this member, aggregated from multiple sources, so it's data above and beyond what is in their local EMR system. This could be things like risk gaps, as you see here. We'll also surface the evidence for each risk gap so the provider knows where this is coming from. You can also surface things like quality gaps that are most relevant to quality programs based on your organization's contracts. Critically, Arcadia surfaces relevant visits. Not just visits that the provider knows about, but any recent activity, even breaking out those high-impact visits. That way, the member doesn't have to be the historian of their own medical record. We can use this to help augment those conversations and really streamline those workflows for your providers.